this podcast, we cover sensitive subjects such as abuse, suicide, self-harm, depression, and other difficult topics. We are not medical professionals. We suffer from our own mental health issues. Our opinions should not be taken as medical advice. Dred the Stigma is for educational purposes and awareness for mental health only.
And welcome to, excuse me, that was a good way to start out. Dred the Stigma podcast, episode 11. As you see, we're going to talk about borderline personality disorder. I know this is strange. For one, it's pre-recorded, and that is due to internet issues that I'm having. My current situation does not provide very good Wi-Fi, and the this podcast and the other one that I do, the Indie Horror Junkie podcast, has at least for me suffered at this due to this Wi-Fi issue. But I thought today, let me see if I can just do a pre-recorded show, because the topic, as I mentioned, borderline personality disorder, is something that's very close to me, very personal, because I have been diagnosed with borderline personality disorder, and I apologize in advance if my dogs try to get on the show. So I want to start out this podcast by showing you playing a little video that'll give you a brief introduction, and then we're going to do a little bit of a deeper dive, a deeper discussion on what borderline personality is. But first, after this video, we're going to start with kind of a history of borderline personality disorder. When did this first start? When was some of the first diagnosis? When did it get into the DSM? These little things. So, I hope you stick with us, or at least share this out, because I think this is very important. Lydia and myself, as you notice, Lydia is not here as well, but she will be back. And this it's very important to understand, if you know somebody or you yourself has been diagnosed, not self-diagnosed, but by a therapist, a medical diagnosis, that you in fact have borderline, or somebody who is borderline. It's very important, because borderline is a very difficult disorder to deal with, from a therapeutic side, from a therapy side, and also from relationships, family, work. It really disrupts everything in a person's life, if not dealt with. So let's start out with this little video. This will give you a little introduction. It's about a 3.5-4 minute video. Give you a brief introduction. Then we're going to come back and we're going to talk about a borderline through the years, and get a little historical overview on borderline personality disorder. So check this out.
It's estimated that at least 1 in 100 people have borderline personality disorder, or BPD. In this video, we'll talk about what it's like to have the disorder, as well as how people can recover from it. Here are some of the issues people with BPD face. Significant difficulty controlling and regulating emotions, otherwise known as emotional lability. Uncertainty of self, what psychiatrists call an unstable self-image. Having intense and unstable relationships repeatedly, which can involve idealizing people, then intensely disliking or devaluing them in relatively short intervals. Feeling an urgent need to avoid being abandoned by other people, even if the abandonment is only imagined. A chronic feeling of emptiness. Repeatedly acting in impulsive and risky ways. As you can see, it's a picture of instability. To add to these challenges, BPD is currently under-recognised, and the availability of specific services is limited. The reason may include the ongoing social stigma of mental health conditions or the challenges that health professionals face in treating BPD. It is quite possible to treat it, but more on that later. Imagine a good friend of yours has BPD. You tell them something about your new partner, and they react ferociously. If you've been hurt by them in one of their more severe episodes of instability, you might struggle to feel empathy towards them. But it's important not to blame the person in such situations. It's not their fault, after all. So what is the cause of BPD? Well, it isn't fully understood. Currently, a combination of biological factors and early life experiences such as trauma is thought to contribute to the development of BPD. In diagnosis, psychiatrists attempt to observe a pattern of these features mentioned before. These must be considered inflexible, pervasive, long-standing, and must lead to clinically significant distress or impairment. In terms of recovery, the best treatment results have been shown with a branch of psychological counselling known as dialectical behavioural therapy. Dialectical means concerned with opposing forces, which here are acceptance and change. Think of some of the challenges mentioned earlier, then consider how that might affect a relationship between a health professional and a person with BPD. It's important to engage clinicians who have thorough experience and understanding of this condition, given that the maintenance of a strong therapeutic relationship is integral to positive outcomes. It may take several goes, but strong improvements are possible. In this video, I've tried to show the challenge and complexity of living with, as well as treating BPD. A recent Australian Senate committee stated that an end to marginalisation of this disorder within the community and the mental health sector is urgently needed. And we'll leave it on that note. See you next time.
All right. So as you can see, there is a lot of instability in all aspects of your life, as I mentioned. And there is a stigma, as we'll see. It's only been really quite recently, less than 50 years. And in the grand scope of things, 50 years isn't that long. I'm 52, so it's not really that long ago. And getting help. I have read that there isn't just one therapist that you see. There's usually, you have a team of people behind the scenes. Borderlines are pretty hard to, for one, even get into therapy. That's the first speed bump, the first hurdle, I should say. And it was that way with me. And then sticking with it is another problem that that borderlines face on the therapy side of things. But before I go off on rants, let me bring up, because we're gonna read it right along together. This is a historical overview of borderline personality disorder from Grouport, as you see up there, grouporttherapy.com. And there's gonna be a lot of reading in this. I'm gonna read a little bit and then we're gonna discuss it. The history of borderline personality disorder can be traced back to the early 20th century when psychiatrists began observing patients with symptoms that didn't really fit neatly into existing diagnostic categories. So already exhibiting the one of the first, hey, wait a minute, what's this? They're exhibiting symptoms that they can't fit into a little box with another diagnosis. In the 1930s, American psychoanalyst Adolf Stern coined the term borderline to describe patients who seem to exist between neurosis and psychosis. At this time, BPD was not yet recognized as a distinct personality disorder, but the concept of borderline patients began to gain traction among mental health professionals. So we're going back to the 1930s, where they're like, hey, wait a minute, you're between neurosis and psychosis. Somewhere in the middle there is a borderline, which I guess when you think about it, it makes sense with the name, even though the name is very, I guess, what's the word I'm looking for? See, I'm getting brain farts here. I need some more of my Monster Wild Berry tea. Yum, by the way, and I'm not getting any kind of sponsorship. Anyway, so where was I? I'm getting myself sidetracked. Okay, let's go down here let me bring this back up. Let's go down here to the emergence of BPD as a distinct diagnosis. And it wasn't until the 1970s and 1980s that BPD was recognized as a separate and distinct personality disorder. So it took roughly 40 to 50 years for it to, be recognized as a distinct standalone personality disorder. 50 years that people were suffering and dealing with these symptoms that they couldn't just throw at another disorder. It was the emergence, I guess, of a new disorder. So the shift was largely influenced by the work of Otto Kernberg, a prominent psychoanalyst who developed a theory of borderline personality organization. He proposed that a persuasive pattern, which I think you kind of heard a little bit about that in the video, that a persuasive pattern of instability and interpersonal relationships, self-image, affect, and impulsive behavior categorized BPD. Whole lot of things going on there. Interpersonal relationships. Yes, there are a lot of mental disorders that disrupts the family unit, boyfriends, husbands, wives, girlfriends, whatever. All kind of interpersonal relationships can be affected by all kinds of disorders. It could disrupt anxiety, depression. Of course, all of these disrupt these interpersonal relationships. Borderline is, because of the complexity, that's almost one of the main things that is disrupted. And please hold on 1 second because it is raining. Okay, that's some rain coming in the window. But so that is one of the things that, as it says, really characterizes borderline. The self-image, self-identity issues are another one. In 1980, borderline or BPD was officially included in the third edition of the Diagnostic and Statistical Manual of Mental Disorders, or the DSM, and it was the DSM-3, solidifying its status as a recognizable or recognized personality disorder. The inclusion of BPD in the DSM-3 marked a significant milestone in the history of the disorder, as it provided a standard set of diagnostic criteria that mental health professionals could use to identify and treat individuals with borderline personality disorder. So with that brought us up to the 80s, and then that's where I want to stop with this particular little intro into borderline. Now I want to share another tab. Now we're going to get into, as the video did, in a very quick overview. You know, it's, you don't really get, you get maybe the tip of the iceberg when it comes to borderline in under 5 minutes, or a 5-minute video. Much more complicated than that, as a lot of disorders are. You can't, you know, it takes a little bit of deep diving. And I have a habit, and I guess it's one of my good habits, that if I'm ever, whether it's, you know, a physical thing, you know, if I've hurt myself or I'm on a certain medication, I research the hell out of it. I want to know what I'm in for. I'm not just taking the doctor's, you know, word for it. I'm looking. I want to see it with my own eyes. When I was given this diagnosis of which was actually borderline schizophrenia, because borderline, which I'm not sure if we'll get into this, but there is a lot of overlapping of different disorders, and borderline schizophrenia being one. They share a lot of the same you know, symptoms and you know, whatnot. So with this one, we're going to get, this is from NAMI, the National Alliance on Mental Illness. And what exactly is borderline personality disorder? Well, it's a condition characterized by difficulties regulating emotion. This means that people who experience BPD feels emotions intensely and for extended periods of time, and it's harder for them to return to a stable baseline after an emotionally triggering event. I have to stop right now because this is exactly what has happened over the past couple weeks. I got hit with just a lot of disappointment, which you started the intrusive thoughts ball rolling. I sunk into a depression that lasted, well, I don't even think I'm completely out of it now. So I'd say about a week and a half to 2 weeks that I have been climbing out of this depressive hole. So it I hit, that was the same situation that caught me off guard and caused me to spiral. Of course, my wife is going through it too, because it was a situation that affected us both. I spiraled into a depression and, questioning my sobriety, fighting off urges to self-harm, to drink. It got that bad for me. I couldn't pull myself out and deal with it like my wife did. Of course, she was stressed, but she, it's still, she was able to deal with it better. I guess that's what I'm trying to say. Now, this difficulty in being able to regulate your emotions can lead to impulsivity, poor self-image, stormy relationships, intense emotional responses to I can't even talk tonight. Stressors, which is exactly what I had just mentioned that just happened to me. Struggling with self-regulation can also result in dangerous behaviors such as self-harm, cutting, uh, uh, addictions, substance use. I was a cutter. And those it's another thing, as I mentioned, cutting and um, not giving into the urge to drink. So, and I can proudly say that I haven't cut and I haven't, fell off the wagon. Um, it's estimated that a 1.4% of the adult U.S. population experiences BPD. Nearly 75% of people diagnosed with BPD are women. And I need to do more of a deep dive into why that is. But recent research BPD, but they're commonly misdiagnosed with PTSD or depression. Another one that is misdiagnosed with is bipolar. I was diagnosed with bipolar since, well, I'd say in the past 25 years or so. I've been diagnosed with borderline personality disorder. I've been diagnosed as, I think it's dysthymia or something. It's a disorder where you're not like real low, you're not real high, you're just kind of blah. Okay. Okay. Well, that was weird. Okay, let me. I know exactly where I was. I'm glad I could actually just come right back in. So I was diagnosed with, as I said, BPD. And again, I'm gonna reiterate due to that little issue. Not all at one time. Some of them were diagnosed at the same time, but I'm just gonna ramble them off up till the current day. BPD, dysthymia, I think is what it's called. Complex post-traumatic stress syndrome, CPTSD. MDD, major depressive disorder. Bipolar, I couldn't tell you if it was 1 or 2. So there's 4. And I can't think if there was any more, but the big ones are, in my opinion, the big ones is the complex post-traumatic stress syndrome, which is very different than post-traumatic or regular PTSD. Not that they aren't both equally as devastating. It's just there's differences there, hence the C in the complex. So, I don't know where I was going with all of this, but there's a lot of different things. The misdiagnosis. Okay, I had to get my bearings back here, so thank goodness this ain't live. Symptoms. Let's go into some symptoms. And again, you don't want to self-diagnose or even diagnose a friend if you recognize a lot of these symptoms in yourself or in a loved one. If you do recognize it, then maybe you should reach out to them. And because this is a very difficult, but here's the thing, as difficult and as horrendous and hard to live with as BPD is, it is 100% reversible. And we're going to get into that thanks to the hard work and dedication of Marsha Lanahan, who is pretty much the creator of dialectical behavioral therapy. So here's some of the symptoms. People with BPD experience wide mood swings and can feel a great sense of instability and insecurity. According to the DSM diagnostic framework, some key signs and symptoms are the following: frantic efforts to avoid real or imagined abandonment by friends and family. Again, this could be something that's not even an issue. Feeling that insecurity that one has, it can lead to, oh, this person's going to leave me. And then you feel as if that abandonment and that person actually leaving you actually happened. And it didn't happen. That person has no intentions on leaving you, but it could be something that triggers you, like not answering a text in a sufficient amount of time, whatever that is in the mind of a borderline. It probably varies. The fact that, or maybe, not answering a phone call. It could be a slight change in facial expressions. It could be a slight change in the tone of a voice that could completely, get a borderline thinking, oh, this person hates me. This person's going to leave me, whether friend, spouse, boyfriend, girlfriend. Unstable personal relationships, speaking of which, that alternate between idealization, oh, I'm so in love, I love this person, and devaluation. I hate her so fucking much. This is also known as splitting. You will go from putting someone on a pedestal, that significant other, and then the next thing you know, it takes one little thing, like the flip of a light switch. That person is the most horrible person walking the face of the earth. I've noticed with myself a lot of paranoia then starts creeping in, thinking that this person is out to hurt me, is lying behind my back, is this, is that. Another symptom here: distorted and unstable self-image, which affects moods, values, opinions, goals, and relationships. Did I not hit it on the head when I said that borderline personality disorder disrupts every part of your life? Every single part, which I'm not trying to say borderline is the worst thing. This isn't like I have borderline, I'm the worst. Oh, I'm the worst. Yeah, this isn't that. Okay. I have a real problem with self-image. And it does affect, moods. I have, issue. I don't like the way I look. Of course, there's a poor, self-esteem in there as well. And, the depression usually is not far behind that. Impulsive behaviors that can have dangerous outcomes, such as excessive speeding or spending, unsafe sex, reckless driving, or misuse or overuse of substances. Mine was really the latter, and all of that, the misuse and overuse and abuse of substances, and that substance was alcohol. I had to finally put the bottle down. It's been about a year and a half. My mental health, I can tell, improved, but I'm not. It did, I like I said, I just had a depressive episode, so it's not like those things aren't happening. But I could tell that I didn't even have this up for you guys. I could tell that my outlook on life was a lot different once I put the bottle down. So I always encourage anybody who's dealing with mental health issues that, I do smoke a lot of cannabis. That does help. I'll probably never stop smoking cannabis. But hey, it is what it is. I'm not saying go out and start smoking weed, but I am saying if you are doing, if you are drinking, from that, my experience, that does not help your mental health and what you're dealing with in your particular disorders. Self-harming behavior, including suicidal threats or attempts. I've had my own close calls and brushes with suicide. One that required about 16 internal stitches and about 17 or 15 external stitches. I was very close at that point. Periods of intense depressed mood, irritability, and anxiety lasting a few hours to a few days. That was very much, there was a lot of anxiety during that depressive down spiral that I was, been dealing with. Again, better now, but it was hard. It was real hard. So that's right there. Chronic feelings of boredom or emptiness. The emptiness certainly comes along with the depressive episodes, and along with, I do say I'm bored all the time, but chronic feelings of boredom, I don't know. I don't think so much. I usually find some that do. I take lots of naps because I love naps. Inappropriate, intense, or uncontrollable anger, often followed by shame or guilt and guilt. Definitely. Absolutely. There's a criteria, the 9 symptoms in the criteria for diagnosing somebody with borderline. You have to have 5 of them. I think I have 7 or 8. And it's not something to be like, oh, well, my life, shit. What, how am I going to get out of this? Why I feel this way, blah, blah, blah. And, that leads, of course, to the self-harming. And I read a stat talking about suicide and those with BPD. And I think it was like 10% of those afflicted with BPD end up either attempting suicide or actually completing it. A lot of times, though, when someone, maybe even outside BPD, but more specifically with BPD, when people do end up following through with the act of taking their own life, a lot of times it's by accident. They call it accidental suicide. Maybe they didn't want to, but they cut just a little too deep, or they're going to hang themselves. That didn't work, or whatever. But let's see. Disassociative feelings. Disconnecting from your thoughts or sense of identity or out of body type feelings. I've been getting a lot of these here lately. Just walking, let's say, from point A to point B, just walking, let's say, down the hallway of this here hotel. And I'll just look around and just feel like, wow, am I actually doing this? I just don't feel like I'm there. And that this is that. And I start questioning reality. And it's crazy. Out of body type of feelings and stress related paranoid thoughts. There's the paranoia that I was mentioning. Severe cases of stress can also lead to brief psychotic episodes. Down here, the causes of BPD, which you can't put your finger on it. There's a lot of variables that will go into it. 3 of the main ones are genetic, environmental, and brain function. There is no specific gene or gene profile that's been shown to directly cause BPD. Research suggests that people who have a close family member with BPD may be at a higher risk of developing the disorder. So my son or my kids are, could be at a higher risk because they were raised by a father with BPD. Environmental factors, people who experience traumatic life events, physical, sexual abuse, as a child, neglect. I'm sure you guys all know of the really bad ones, the physical, sexual, and emotional, like on the big 3, all 3 of which I've been through. Brain function, the emotional regulation system may be different in people with BPD. Suggesting that there is a neurological basis for some of the symptoms, specifically the portions of the brain that control emotions and decision-making. Judgment may not communicate optimally with one another. So decision making and your judgment, they're just not fucking there. Diagnosis. There is no definitive medical test to diagnose BPD, and a diagnosis is not based on one specific sign or symptom. That's what I mentioned. I'm not sure. Let me see when this. I don't see a date when this came out, but I'll mention the criteria. BPD is best diagnosed by a mental health professional following a comprehensive clinical interview that may include taking or talking with previous clinicians, reviewing previous medical evaluations, and when appropriate, interviews with friends and family. So that, if you know somebody or you yourself have recognized some of those symptoms, some of the things that I've told you I've experienced, I didn't get treatment for a long time. I was diagnosed in maybe when I was like 26. And I didn't really start getting the treatment until almost 52, within the past year. Um, so you don't want it to go that long. There were a lot of times where my life was at stake. And I just kept on down that road, highway to hell, baby, you know. And I was close to losing, my wife, my family. Um, so definitely get going with some therapy, and which is what we're going to talk about right here with the treatment. An effective treatment plan should include your preferences, while also addressing any other coexisting conditions you have. Examples of treatment options include psychotherapy, medications, and group, peer, and family support. The overreaching goal of treatment is for a person with BPD to increasingly self-direct their own treatment plan. They learn what works and what doesn't. Psychotherapy, such as dialectical behavioral therapy, cognitive therapy or CBT, and psychodynamic psychotherapy, usually of choice and for those with BPD. Learning ways to cope with emotional dysregulation in a therapeutic setting is often the key to long-term improvement in BPD. Of course, working through trauma. Trauma changes, and this is a whole nother show. Trauma changes you, health-wise from a physiological standpoint to, of course, a mental health standpoint. It just changes you all over. Of course, the severity of that change depends on the severity of the trauma. So, it's you're going to have to work through some of that because that trauma, you kind of, at least with me, I kind of, I got into a thinking pattern, a coping pattern that was not healthy. And it was when I'm stressed, I'm drinking. When I'm happy, I'm drinking. When I'm depressed, I'm drinking, and then that's when all the other bad stuff comes out. So that is, DBT is something, and I want to spend a minute on this because in the video it did mention it's hard. You're going to go through therapist after therapist after therapist. You must be picky. If you do not, if you don't resonate, that's the word I'm looking for, resonate with a therapist, you can very politely say, hey, I like to find another therapist. I don't know. I don't want to waste your time. I don't want to waste my time. And go with somebody else. I've done that once, and then as those of us dealing with mental illness, our memory is just fucking shot, man. People can joke and say it's all the weed you smoke. No, okay, no, it's not. But see, I don't remember where I was going there. Told you. Anyway, let's. Oh yeah, you want to find somebody who. I lost my second therapist due to I missed the appointment. Now I'm working on therapist number 2, and we will see how that goes. But you want to find somebody who is licensed, who is trained in DBT, to be, completely and as effective as it can be. Let's see what we got here. Medications. I am on some medications, and medications along with psychotherapy could be the key. Just psychotherapy could be just what somebody needs. Medications may not be have to be brought into the equation. I was big anti-medication because I had a lot of bad reactions to some medications, hallucinating, convulsions, seizures, throwing up on myself. It was just horrible. Medications may be instrumental to a treatment plan, but there's no one medication specifically made to treat the core symptoms of BPD. Rather, several medications can be used off-label to treat various symptoms. If you don't know what the off-label is, that's just where it's not either FDA approved for that particular illness. It's approved for something else, but then used for a mental health issue. One example of that would be gabapentin, aka Neurontin. I was prescribed that years ago. It's a very strong nerve blocker. It goes right to your central nervous system. It really helped when I have bulging disc in my neck that pinch nerves. It really helps with that. But it also has, helped when I took it, helped my anxiety more than anything that I think I've taken, including what I'm taking now. Although what I'm taking now, propranolol, is working well for my anxiety, but nothing like gabapentin. So that's that's what they call an off-label medication. Some doctors will prescribe you gabapentin for mental health. My doctor does not. He does not prescribe anything that has a street value, and I respect that because I don't want anything addictive, even though I know gabapentin I don't think really has a high addictive rate. So, for example, mood stabilizers, that's one of the things I'm on, and antidepressants help with mood swings and dysphoria. And for some low-dose antipsychotic medications may help control symptoms such as disorganized thinking. And another treatment option is short-term hospitalization, may be necessary during times of extreme stress and or impulsive or suicidal behavior to ensure safety. And I've dealt with all of that. In fact, a short-term hospitalization is one of the things that is the one thing that kicked all of this off on my, I guess, road to recovery. What am I doing here? I'm looking for something. Here we go. Oh no, I don't want to do that. Cancel. That okay. Phew. Boy, I almost did a doozy there. Almost left you guys. Okay, I got one more thing that I want to get to here in the last few minutes and end on a positive note. After hearing about how horrible BPD is, and it is. It's horrible to live with. It's horrible for those who live with somebody with BPD. Family therapy, having that strong family support system is very, very important. As with any illness, whether it be a physical ailment or mental health. So let's talk about DBT. This is from, as you can see, Psychology Today. And you have to understand that there is a very except in, I guess, extreme cases, but there's usually, a very high rate of success in getting people back to a stable uh, uh, mental health plateau and be able to live productive lives using the tools that are there, such as DBT. Now, it's a structured program of psychotherapy with a strong educational component designed to provide skills for managing intense emotions and negotiating social relationships. Originally developed to curb the self-destruction or self-destructive impulses of chronic suicidal patients. It is also the treatment of choice for borderline personality disorder, emotion dysregulation, and a growing array of psychiatric conditions. DBT isn't borderline specific as a treatment. This is CBT and DBT. I think mainly CBT is used a lot for those with PTSD. It helps in those areas. DBT may be more aimed to borderlines, but it is the go-to choice, even though it has it is a multifaceted therapy. I'm just making stuff up, I guess. It consists of group instruction and individual therapy sessions, both conducted weekly for 6 months to a year, and possibly longer. It could be, normally people do drop off, not need the medication anymore, not need to have those DBT sessions. And you can just go on, about your life. But normally, when you start out, look at the next 6 months to a year of doing that. The dialectic in dialectical behavioral therapy is an acknowledgement that real life is complex, and health is not a static thing, but an ongoing process hammered out through a continuous Socratic dialogue with the self and others. It is continually aimed at balancing opposing forces and investigating the truth and powerful negative emotions. DBT acknowledges the need for change in a context of acceptance of situations and recognizes the constant flux of feelings, many of them contradictory, without having to get caught up in them. Therapists, teachers help patients understand and accept that thought is an inherently messy process. DBT is itself an interplay of science and practice, and it is used for, as I mentioned, a lot of different types of, let's say, personality disorders, people with self-harm, PTSD, as I mentioned, bulimia, binge eating disorders, depression, anxiety, substance use disorder, and bipolar. Some of the very big ones that permeate our society: suicide, depression, anxiety, substance use disorder, which was another one that I was dealing with when I was mentioning what I was diagnosed with. Now, what you can expect from something such as DBT are these 4 areas. These are the key 4 areas that DBT will help in honing these skills. 1, mindfulness. Mindfulness enables individuals to accept and be present in the current moment by noting the fleeting nature of emotions, which diminishes the power of emotions to direct their actions. Stay in the moment. That is so hard. For a lot of people, I guess it comes easy. You're taking it all in. Me, my head's all over the place. Sometimes it needs to slow down and be more mindful and live in the moment. It's something I'm practicing and working on. DBT also in I don't know, the ability to tolerate, it helps you with the ability to tolerate negative emotion rather than needing to escape from it or acting in ways that make the difficult situations worse. As I mentioned, when things got bad, negative emotions, distress tolerance, which mindfulness, distress tolerance. When I would get in those difficult situations, I would go to alcohol 9 times out of 10. Didn't make the situation any better, made it a lot worse. Number 3 of one of the key things that you will learn through DBT, emotional regulation. Strategies that will that give individuals the power to manage and change intense emotions that are causing problems in their life. I have a lot of them. And last but not least, DBT teaches techniques of interpersonal effectiveness, allowing a person to communicate with others in a way that is assertive, maintains self-respect, and strengthens relationships. A core principle that is that learning how to ask directly for what you want diminishes resentment and hurt feelings. And as I mentioned, DBT incorporates many of the techniques of cognitive behavioral therapy, and helping kind of to rewire your thinking, to rewire your brain, because whatever it was that brought you to being diagnosed with borderline, whatever trauma it was, that doesn't matter. But that trauma changed your maybe perception of the world, your perception of others. I became very cynical. I still am. And those thinking, that distorted thinking just brought about a lot of distorted coping skills. And DBT, that's a big thing. We have to rewire our brains in a sense to better coping skills, not going for the drink, not going for a razor blade, not doing those self-destructive things. For some people, it's gambling or spending. I never had a lot of money, so I didn't have to worry about that. But yeah, that's DBT, and that's BPD. We got a lot of BP. We got a lot of the alphabet disorders. So I'm sorry that this was not live, but I really wanted to take and do this and talk about borderline. I post a lot in the group about borderline. I guess I'm playing favorites, but that is what I've been diagnosed with. So speaking of which, tell your friends, share around YouTube. We don't have a lot of subscribers yet, but I'm being patient. This is the things that we talk about here on Dred the Stigma is sorry, my mustache keeps tickling my nose. Is something that everybody can connect with. And I hope that you connected possibly with me in watching this. I hope I was able to pass on some information that maybe was helpful. But education, open conversations about mental health tears down the stigma, brick by brick. Conversation, one discussion after another. Every discussion, every new person that gets involved in the discussion, well, that is just, that's where change happens. And we need to show that, hey, it's okay. It's okay to talk about this. It's okay to not be okay. All the cliches. I rhymed a lot right there. And it is okay. Again, thank you guys for taking the time and watching, learning a little bit with me as well about BPD. It is something that I've looked a lot into. As you see scrolling across the bottom of your screen, you can call or text 988. That is the quick and easy way to get help if you are in a crisis or someone, your loved one's in a crisis. Text 988, and you can get the help you need right there. And you can chat with somebody. I've done this before. It actually kind of kicked off my getting help. I didn't quit drinking yet. I didn't really like the therapist I was dealing with, so I quit that and went back to some bad ways. But I have used it, and it was very helpful. So with that being said, I hope that this episode helped in some way. And you guys have a great rest of your day or night whenever you are checking this out. And thank you for checking it out. Please spread it far and wide. Dred the Stigma on YouTube, Dred the Stigma on Facebook. And look forward to talking to you soon. Take care.